more of the same, but we're just going to keep talking about some of these things. If I say it enough different ways, somebody will catch part of it. You know, and this is definitely one of those areas where every time I teach it, I gain a better understanding of how this whole system works. Okay. So it attaches indirectly to the rib cage. Anteriorly, it's going to be concave. We know that subscapularis then lives in there. Glides over the convex rib cage. Located between the 2nd and 7th ribs. Okay, so 1, 2. So this one is actually right about the top of the 3rd rib to the 7th rib. Okay. So that gives you an idea of where the scapula should be located. So if you think about that, if you go in and you can like palpate the ribs, you can say, okay, that's right about where it ought to be, or one's higher than the other, one's too low, or something like that. Okay. The vertebral border, so the border by the spine, or by the vertebra, so the vertebral border should be about 2 or 3 inches lateral from the spinous processes. Okay, so in a bigger person it might be further away, in a smaller person it might be close together. Okay, so there's no absolutes on that, but what you want to do is you want to look to see that there is some space, and that that space is pretty even side to side. Like if you're assessing somebody's shoulder, you need to really be looking at that. Okay? You know, and this is where it's helpful to take a patient in a private room and have them put on a gown so you can actually see their skin, see their scapula, see their scapula move. Okay. So here's just a reminder of all of the important parts of the scapula. So looking front to back, okay, here's your vertebral border is always going to be opposite of the glenoid fossa. So then this is going to be always your axillary borders on the same side as the glenoid fossa. This is your inferior angle. You remember that's the point of reference for that rotation. Okay. Looking anteriorly, the most structure you're going to see is the coracoid process. And then you've got a little bit of the acromion that you see there. Okay. Posteriorly, you've got the spine of the scapula that terminates in the acromion process. Okay, if we're looking at it, this is the lateral view, so this is looking at it this way. Okay, so looking at it from this way, you clearly see the coracoid process. Here's your axillary border, there's your acromion, and there's your coracoid. Okay, so 5 muscles attached to the scapula and or clavicle and provide shoulder girdle motion. Actually, there's more, but these are the main ones. Okay, so, and I can, let's see where this goes next. Okay, so trapezius, we'll just go over the list. Trapezius, levator, scapula, rhomboid muscles, so rhomboid major, rhomboid minor, serratus anterior, and pectoralis minor. Okay, so we'll go over these one by one. Okay. All right, so with our trapezius, this is a huge muscle because it actually begins its attachment up here at the base of the skull. It attaches along the spine down into the low thoracic area. And it comes up and it has an attachment all the way around the spine of the scapula. So can you see that fibers are going in 3 different directions? Okay, so we're going to divide it into 3 different parts, upper, middle, and lower trapezius. Okay, so the upper trapezius, these fibers are going to pull up. I know you can see that. Okay, so what's that going to do? It's pulling from here. So it's pulling from here, so it's going to help with elevation, but it's also pulling from here, so it's going to do that upward rotation. Can you see that? Middle trapezius. Can you see how that's pulling together? So if we bring this in here, abduction or retraction. Okay, lower trapezius is here, okay? So again, we're pulling here, so we're gonna pull, it's gonna be,
Is that downward rotation?
yeah, okay. So it's gonna be pulling, actually pulling here, so yeah, you're right, it's gonna be downward rotation. Okay? Let me just fix that right now. Oops. Oops.
Yeah.
You see how these things happen, right? All right. Levator scapula. Okay, levator scapula is gonna, basically it attaches at this upper angle.